When people said to me, when I said I'm coming here because this is the first, we do these discussions across the country, but this is the first one post-Roe, and a number of people said, why Alabama? That was my question coming into this conversation. It's becoming abundantly clear why Alabama.
It's been tough. Reproductive health services has essentially shut down. So we are closed and unable to do anything except answer those calls. When you know you can help and you can't, just right through you. And it's hard, especially when you're talking to someone who's worried about their child, or I have a teenager on the phone, or something like that, or someone who's been assaulted. It's been tough to have those calls.
The assault thing is a good point, but it's also like, you shouldn't have to be assaulted, right, to have reproductive agency. Like, maybe I just don't want to have a kid. Maybe I just don't want my third kid. Maybe I don't have the finances. Maybe I just don't want to parent, right? We've had a lot of people come from domestic violence and say, I'm not going to be able to leave this situation with a pregnancy. And having to turn people like that away is infuriating. In Alabama, the services are so stigmatized. It's like they can't really reach out without the fear of DHR saying, oh, well, you need help. That means we should take your child.
The way the law is set up, or the way things are in Alabama right now, they're doubly concerned. They're concerned about the pregnancy, and then they're concerned about the fact that the government may come in and separate their family.
Right. When we first got started, it was, okay, well, did you try some of these programs right before I really educated myself on the topic? And they're like, I don't want them to come remove my child from my home. I just need food. And that's a really sad realization to think that that phone call where you reach out for help means that you might have your child removed, especially in a pregnancy that you didn't really have the option to keep or terminate. So.
And if you look at what our government has said that they are investing in right now in the state when it comes to this whole post-Roe landscape, the two things that they said that they're investing in is trying to train more families to be foster care parents and making sure that there are more adoption agencies that are out there. They have no intention of making sure that people can parent the children that they would be giving birth to. They want to give them away.
Which is exactly code for, like, we're going to split up families still, which is like America's MO, right? But I think people don't really, they hear that and it doesn't sound so bad. They're like, well, kids need, like, no, that's code for, like, they're going to intentionally separate families, pull kids out of homes.
That's America's MO. You think that that's in our DNA right now?
Separating families, absolutely. Separating black families,
and they already do that. I mean, we have these chemical endangerment laws on the books that they target and profile patients, pregnant patients, and patients in the hospitals where, a patient comes in just on suspicion, they don't look like they're dressed right, let me go ahead and drug test them. A lot of hospitals don't even do pregnancy, they don't do the drug test confirmation, so they might have a false positive, but the ball's already gotten rolling on DHR getting involved. And hey, hold on now, actually the confirmation test came back. It was a false positive. Well, we've already made the call, so the ball's already rolling. And what that means, once they get involved in the system, and it was a false positive.
Pre-Roe, we were already dying in childbirth. Pre-Roe, we could already not get abortions. This is going to change the trajectory of a lot of folks' lives, especially a lot of black folks or people that are in school, right? I think the highest percentage is like 20 to 29. Those are school years. That can change the whole trajectory of someone's life to have to get out of school. And then this is a state with $7.25 minimum wage. So this is a state that's also going to tell you, well, you should have gone to school, should have got a degree, and this will be fine. Well, I had a child that I didn't want in a state that told me I needed to have one. So I think a lot of what goes on in Alabama is by design, and it really makes people feel stigmatized. It makes people feel as if they failed themselves, right, in a state that really is designed that way for you not to succeed.
It's almost like in Alabama, we do as much as possible to sanitize our communities of people who don't think like certain folks, don't look like them, don't act like them, or vote like them. So we try to make life so hard here that you don't want to live here.